All right, today we're going to play medical detective and solve a really fascinating puzzle. We're talking about a condition that can fool even the best doctors and hide right out in the open. So let's dive in. So picture this. Someone you know, maybe a friend or family member, just suddenly starts acting, well, not like themselves. They're getting confused, their whole personality seems to shift, they might even have seizures. Your first thought, my first thought, everyone's first thought is, okay, something's wrong with their brain, right? Has to be a neurological thing. But what if I told you that in this mystery, looking at the brain means you're looking in the completely wrong place? The real culprit is actually hiding out somewhere totally different, in a small organ you barely think about, tucked behind the stomach, called the pancreas. And this, my friends, is where our detective story really gets going. Okay, so first things first, in any investigation, we have to look at the clues. But with an insulinoma, the clues, the symptoms, are incredibly tricky. It's almost like they're designed to throw us off the scent. This is what makes this such a compelling medical mystery. The symptoms are all over the place, and they are so deceptive. We're talking headaches, confusion, even massive personality changes. The core of the puzzle is that all the signs are screaming brain problem, but the cause has nothing to do with the brain. It's all metabolic. This misdirection is exactly why the real culprit can hide for so long. All of these problems are being driven by dangerously low blood sugar, what doctors call hypoglycemia, and they tend to show up when someone hasn't eaten for a while. So, with all these misleading clues pointing in the wrong direction, how do doctors actually see past them and start gathering the right kind of evidence? Well, this is where the real classic detective work kicks in. Believe it or not, the main investigative tool is surprisingly simple, but it is incredibly powerful. It's a hospital-supervised fast that can last up to 72 hours. Why? Because our culprit, this insulinoma, can't help but show itself when the body is running on empty. In fact, for most patients, something like 70 to 80% of them, the key symptoms will pop up within the first 24 hours. Now, during this fast, the investigators are on the lookout for a very specific set of 3 clues. It's a classic in medicine called the Whipple triad. Okay, so clue number 1, the symptoms we just talked about, they show up. Clue number 2, right when those symptoms appear, they do a blood test and bingo, blood sugar is in the basement. And clue number 3, the final piece of the puzzle, you give the person some sugar, some carbs, and just like that, the symptoms vanish. When you see all 3 of those things together, that's the smoking gun. But hold on. Even with a smoking gun like the Whipple triad, there's one more plot twist. A good detective has to rule out a really fascinating red herring, the chance that a person is secretly injecting themselves with insulin. That would cause the exact same set of clues. So how can they possibly tell the difference? They use this absolutely brilliant test that looks for something called C-peptide. Here's the easiest way to think about it. When your own body makes insulin, it's like a 2-for-1 deal. You get the insulin molecule, and it comes attached to this other molecule, C-peptide. But the insulin you'd get from a pharmacy is just the insulin part, no C-peptide. So it's simple. If C-peptide levels are high, it proves the body is overproducing its own insulin. If C-peptide is low, it means the insulin is coming from an outside source. It's the definitive test that cracks this part of the case wide open. Okay, so we've gathered all the evidence. We've ruled out the red herrings. It is finally time to unmask our culprit. So, what exactly is an insulinoma? At its core, an insulinoma is a rare tumor. And it's made up of the very same cells in the pancreas. They're called beta cells that are supposed to be making insulin in the first place. And as we know, insulin's job is to lower our blood sugar. The best way to picture this is to think of that tumor as a rogue insulin factory that's just gone completely haywire. It has stopped listening to any of the body's signals. It just pumps out tons and tons of insulin, 24/7, flooding your system with insulin it doesn't need. And that is what sends your blood sugar levels crashing down, especially when you're fasting, causing all those bizarre, puzzling symptoms. Now, hearing the word tumor is always scary. I get that. But the profile of this particular culprit is actually pretty reassuring. For a full 80% of cases, these are single, solitary tumors, and they're benign, which means they're not cancerous. Only about 10% turn out to be malignant, and another 10% of cases involve multiple tumors. And it's really important to keep in perspective just how rare this is. We are talking about one case for every 250,000 people per year. This is a true medical unicorn. So now that we've identified our culprit and we know what we're dealing with, how do we finally solve the case? let's take a look at the treatment and what the future looks like for someone diagnosed with an insulinoma. This number right here, this is the most important number in our entire investigation today. For the huge majority of patients who have a benign insulinoma, a simple surgery to remove the tumor has a cure rate of about 90%. I mean, that is just a fantastic prognosis. So yeah, surgery is definitely the main event. It's a primary treatment, and the goal is a complete cure. Now, if for some reason surgery isn't possible, or maybe the symptoms continue, there are medications that can basically tell that rogue insulin factory to slow down and get the low blood sugar under control. And then for those very rare malignant cases that have spread, chemotherapy is an option, but its main job is really just to slow the tumor's growth. Well, we've followed the clues, we've unmasked our culprit, and we have solved the case. So before we close the file, let's just quickly review the key takeaways from our little investigation. All right, let's file our final report. 1. Insulinomas are rare tumors in the pancreas that cause your blood sugar to crash when you haven't eaten. 2. The symptoms are famously tricky, and they do an amazing job of looking like a brain or psychiatric problem. 3. The diagnosis all comes down to catching that Whipple triad during a monitored fast. And 4, and this is the most important part, the vast majority, around 90%, are benign and can be completely cured with surgery. You know, this case really shines a light on such a fascinating truth in medicine. You can have a condition that is incredibly rare, but its symptoms can be super common. It really makes you wonder, doesn't it? What other medical mysteries could be out there, hiding in plain sight behind everyday symptoms, just waiting for the right detective to come along and uncover the truth?